the practice is the goose that laid the golden egg. So the goose is what's important, the practice, not like one person. Well, no, the practice is there. Practice good medicine, you'll thrive. That's what I was told. And that we took Medicaid, which a lot of places did not. Like no doctor in Huntington took Medicaid, which is, I'm sure, a stark law violation. Like they all got together. And so we would have a lot of Medicaid patients, and that was certainly fine with me. That we took care of those patients that couldn't afford to pay the bills. That's how I was brought in and was very happy the way things were running.
And what was the biggest change you saw as things evolved from the 80s to today?
I think, like Dr. Kaplan said, is the insurance. And like I said, like now no one would say, what do you charge for a visit? It's meaningless. But then it was important what people charge for a visit. You know what, Dr. Kaplan, I'm thinking back, there were some people that had insurance where they would pay us and then get reimbursed, and people would actually get the reimbursement and not pay us. Like there was stuff like that going on. And that irritated me to no end, but that was how it was. And how, so in some ways, things are much simpler. Even as complicated as insurance is, you don't have to worry about going after every nickel and dime from people. You just deal with the insurance companies. As difficult as that is, in some ways, it's better. It's better.
Well, and it seems like you think that access, taking care of everybody, being available and practicing good medicine is the glue that held you all together.
Yes, I think so. And it's unfortunate now we try, when we hire people, nobody wants to work Saturdays, but I never questioned it. I probably worked my first year, worked just about every Saturday. And then gradually I would get Saturdays off. And I knew it was important. Like people, it was very busy on Saturdays. People came in for babies. Dad stays home, mom brings the baby, and vice versa. And kids got sick on the weekends, and we were there.
Saturday is the busiest day of the week for everybody. And if you look at it from a financial point of view, it's the biggest income generator. So why not? Take off on Tuesday. Done.
And so what do you think is your legacy? You're still part of it, but you're not as involved as you used to be.
No, I don't know about legacy. We all tried hard, but like now I enjoyed just yesterday, I saw a 6-month-old baby and the mother came to us and she called me Dr. B. Like a new patient, I wouldn't call me Dr. B. So relationship there, and it just makes things much smoother and nicer. I enjoyed that. We just all try to work hard and keep it moving along.
And when you came into it, do you think that the beast, the goose would last 60, 70 years?
Yeah, I was certainly hoping so. I was young, but no, I can see we all worked hard. We did what we had to do to keep things going. So no, I always looked at other practices. A lot of pediatric patients on Long Island, there's not a shortage of kids. So you knew if we just worked hard, like Dr. Brown said, and took care of the practice, we would thrive. I always felt it.
I know Neil used to say all the time, and Dr. Kaplan, the practice is better than any one physician. And I think that's the glue.
Yeah. That is a very
spill that onto everybody else, onto Jim, onto Nick, to Scott, so they don't get crazy on me.
Yeah, it's like a kibbutz mentality, right? It's the community is more important than the individual, which is not seen a lot in our modern day. Everybody cares about themselves and not about the community as much. And Dr. Raymond, you came in later and brought all your beautiful patients to the RBK.
Interestingly, my first encounter with Dr. Reichman, Dr. Brown, Dr. Kaplan was when I joined residency at the Good Samaritan Hospital. That was in 1970, and was very friendly with them. They were the attendings. I was the resident. And then, of course, after graduating, finishing the residency, I joined Dr. Grello for 5 years and then started my own practice. And when time came to retire, George Rogu was great. He said, come and join us. We'll take your practice over. We had a great talk, and that's how it started with RBK. I never knew that RBK had an office in Brentwood.
We did.
Yeah, that I didn't know. I knew the Comac office,